PSI, we have one patient, nature of illness, we call for cardiac arrest, and call ALS. We move in. There's no apparent signs of life, so I'm going to check their pulse. While listening to their, for breath sounds, watching chest rise and fall, I don't see chest rise and fall. Is there a pulse?
No pulse.
No pulse. Okay, so I'm going to go right into chest compressions. My partner will be setting up the AED while I do this. Before I check for CAD, should I have considered C-spine?
Yes.
I think you do, yeah.
Okay.
And you just would have said, is there a mechanism of injury? And they would have said no. Is there any reason to check C-spine? No.
And the correct rate for compressions is 100 to 120 per minute.
Per minute.
Analyzing heart rhythm. But do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now.
Unclear, sounds clear.
Now.
Clear.
Shock delivered. Pause. If needed, begin CPR.
Is there a pulse?
No.
You don't check.
Continuing CPR.
You deliver one breath every 10
seconds.
compressions.
So the one I just gave you.
And we don't stop too, remember? We only stop at the end when it says no shock advised.
We only stop when it says no shock advised. Or if we lose our glasses. Patient has regained pulse.
Okay, is the patient breathing adequately?
Patient is breathing at 9 breaths per minute.
Okay, so we're gonna put them on a non-rebreather, 15 liters of oxygen per minute. So that on them, and then we're going to transport them with priority 1 to a cardiac center.
Correct.
And reassess every 5 minutes.
Yes.
Is there priority one?
Because they're priority 1.
Oh.
All right, scene safe. We have our PSI on. We got one patient. Nature of illness in this case, breathing issues. Call for ALS and check for C-spine. Is there a C-spine?
No.
Okay, so we go right in. Hello, sir. You tell us what happened. Patient's not responding. Patient's unresponsive. In this case, I checked for his pulse first, CAB, while also listening for breath sounds and checking for chest rise. Nothing. So I'm going to go ahead. Does he have a pulse?
He does have a pulse, but is not breathing.
All right, has the pulse but not breathing, so I'm gonna do a head tilt chin lift because C-spine was all right. 1, 2, those are 2 rescue breaths. I'm gonna have my partner put that up to 15 liters of oxygen per minute.
And you're going to want to
do this every 5 seconds.
give at least every 6 seconds.
One breath every 6
One breath
seconds.
every 6 seconds.
And it should probably be a bit slower than that. And it doesn't matter, I gotta take my time with this. I'm going
And when you
too
hook up
fast.
the oxygen, you're going to make sure the bag is fully inflated while you're giving him the breaths.
That's this bag. Okay, so. I feel like I'm missing one.
Which one are you looking for? This one?
Yeah, I was looking
Oh,
around.
you're looking at this.
Covered it.
So the way you measure the oropharyngeal
Make sure the
airway-
chest is rising.
Oropharyngeal.
Oropharyngeal airway is from
Here to
the
there.
earlobe to the corner of the mouth.
Okay. And then it is inserted.
Take.
And using the
Use
tongue
this
depressor.
to push back the tongue. Side.
Yep, got it.
And you gotta get back in there, give it his breath. Again, watch for chest rise. And you-
So your patient now has a gag reflex.
So pull this out. We're gonna turn to the side. I'm assuming there's vomitus in there.
This is because if you turn it
Turn
this
to
way,
that
please.
side. So you don't want to lose sight of this. You want to check for suction. Put your thumb over here. Make sure suction's working. You want to see the end of this at all times.
Take
Go to
it.
the very back of their throat.
Take your thumb off while you're pushing it back.
Take what?
You don't push your thumb on until you're...
Oh, don't push your thumb on until you're in there. Then you place it on and just suction on the way out. Get her as much as you can. It shouldn't take you more than 10 seconds. Is everything out?
Yes.
Okay, so then after that, put them back over.
Your patient
Come back
has,
on 'em.
should I do regained or has a gag reflex but is still not breathing spontaneously?
Then we got to give him nasopharyngeal. And this would be from the earlobe to the nostril, correct?
Yes.
Is that right? I think that one's a little too small. Can you give me one size up?
And nope. For proper administration, you must use.
It was already lubed.
It was already lubed,
My
but for
partner
proper
took care of that.
administration, you must use a lubrication. Water-based lubrication. Okay. And you continue to give one every 5 seconds or 6 seconds. And now the patient has regained spontaneous breathing.
So they're breathing in. Okay, so we stopped doing this and we put them on a non-rebreather at 15 liters per minute, which was already on, but just.
Another important note is to make sure you put the nasopharyngeal in the right nostril.
Always try the right first.
Always try the right nostril first.
And then after stabilize, we take them, well, after they're on the non-rebreather mask, we package them for transport, notify the hospital, and we'd reassess them every 5 minutes because they're high priority, number one priority.
I got this.
All right, let's do it. So tell me when you're ready.
I'm ready.
Oh, okay. Oh, my back is so messed up today.